Namaste and welcome back. I hope you all are doing good and staying safe and healthy and keeping good care of your mental health. Now, as I would like to again introduce myself, I am Dr. Mukut and I specialize in HIV medicine and as well as in public health program, and I'm working in the same sector. So today's discussion would be more about my own topic, and that is HIV/AIDS. Very frequently, when I speak about this topic to general audience, they literally ask me a question that what is HIV and what is AIDS, whether they are same or whether they are different. So the real understanding of this two terminologies is that HIV is the virus which eventually, once it gets into the body, leads to decrease in immunity, and gradually and slowly it leads to the progress of the infected individual to AIDS, which is acquired immunodeficiency syndrome. HIV, the name is human immunodeficiency virus. This is the name of the virus which infects. Now, very it's kind of like we want to know that what exactly causes the virus to get transmitted to an individual. Usually, in the due course of time, the virus had been always associated with sexual encounter, unsafe, unprotected sex with an individual who's already infected with the HIV virus leads to its transmission to the healthy individual. This is what we are all aware of, but there are other three modes which are also responsible for it, and that is, number one is transfusion of blood, that is an infected blood if it is transfused to a non-infected individual, or any bodily fluids or any organ donation. When it happens, we need to check whether that organ or whether that fluid or the blood is infected with HIV, because if it is infected, then it will definitely transmit the virus to the uninfected individual. Following to that, the second another cause is mother to child transmission. If an infected mother, that is an infected lady, a reproductive age group woman, gets pregnant, and if she's not on antiretroviral treatment which suppresses the virus and keeps immunity high, in that particular cause, it will lead to the transmit of the virus from the mother to the child. It is not 100%, but there are chances, and the chances are on an average 40%. There are different stages through which it can transmit, but on an average it is 40% that it can transmit the virus from an infected mother to the baby. And along with this, the third cause is when there are individuals who are injecting drugs, that is, or through an infected needle, it can transmit the virus. So these are the basic causes, along with the sexual intercourse which is happening with an individual who's infected, and it is an unprotected sex. So these are the four reasons of the transmission of the virus from an infected individual to the healthy individual. Now, with this, another question which erupts into the minds of people is whether it is a death sentence or not. Definitely not. HIV is not a death sentence if you are getting yourself tested for the virus, and if you are infected with the virus, then you have to be on antiretroviral treatment ASAP, as soon as possible, without thinking at all. Treatment is available in every sector, whether it's public sector or whether it's private sector. And it is a treatment which has to be taken lifelong. It is a manageable disease. It is not curable as of now. It is treatable but not curable. It is manageable just like any other chronic disease, such as diabetes or hypertension. So what I would like to emphasize to all of you who is watching this video, don't hesitate to talk about HIV. Don't hesitate to discuss about it openly. And get yourself tested for HIV so that you know your status, you live healthy, and you lead a healthy and a responsible life. With this, signing off, take care, and I'll be back with the next video with more about HIV and AIDS and how to manage yourself. Take care. Namaste.